heard Che Guevara's name in the context for many generations. And I thought he captured it quite essentially about how a person moves from a sense of privilege, as Che Guevara did, travels across a continent, and then changes away. And so we have essentially listened with passion, responded with humility. We renewed our commitment to justice, acting with justice. The Ministry of Health of it, Ministry of Health of the Public. Don't think we can say great enough, both in legitimizing this conversation, came out in great numbers. But Allah Abdullahi, thank you for being here as a presence throughout the meeting. Just expected you, and it really sense of from the ministry. But this last few minutes is really about thanks and really to celebrate what we've done over these last two engagements that we had, actions deepened over the last 2 days. As we would say in the Xhosa language that is in the Western Cape, Enkosi kakhulu.
Thank you very much, Professor Green Thompson, for those warm, welcoming words. And now, Your Excellency, beyond the deliberations that we've had here at MedEdAfrica 2026, it is my firm belief that you've had the chance to experience the warmth of Ethiopian hospitality. So now to officially open this closing ceremony, it's an honor to welcome our host on stage. Give a warm welcome to Her Excellency Tahar Abdullahi, the State Minister of Ethiopia's Ministry of Health.
Can you hear me? Invited guests from all across Africa and Europe. I wish I could stay long. Yesterday I was in another commitment, another engagement. As you all know, Ethiopia is also trying to host COP32 on 2027 at Addis Ababa. So we are working with the fact-finding mission. So unfortunately, I couldn't stay with you with the whole event, but I had received, you had a good conversation regarding all the thematic areas and all the panels, discussions, especially that the Ethiopia's government and the Minister of Health also sharing our little experience, because Ethiopia is a big country, but we expect more, we have to do more, but we share a little experience regarding on the residency matching program that we have been given a privilege to our beloved sisters and brothers from the neighboring country, the Rwanda, Sudan, and Somalia, as well for South Sudan. As an Africa, we are both in one continent, and we believe that as a country, Ethiopia is also a Pan-Africanist country, and the capital city of Africa. We believe we more explore and address more African countries and sisters, especially in the medical education, for the quality and harmonization of the curriculum that we have been also implementing in our country. We believe the COMSA and Professor Lionel, all the academia, the deans, and the medical educations, especially for those young leaders who will be also the future leaders from the Medical Students Association. They have been here from the African and from our country, Ethiopia. So they are our futures, our future leaders and our future vision. So I wish you have also the best stay and the pleasant stay in Ethiopia. But uh, from my side, I little bit regret I couldn't join you the whole event and the whole occasion, especially during your discussion, especially in this strategic commitment and strategic discussions. And today, maybe Her Excellency Dr. Magdas will join us in between the event, but unfortunately, she couldn't join. I would like to ask an engagement in the big engagement that as a country we have been also expecting to host the COP. We have been expecting this event is gathering around 800, but we are expecting also around 70,000. So we need all the African countries, your support and experience. Previously, I think we will be the third country as an African to host this large event, Algeria and Morocco, the Marrakesh. But we believe that we are the Adwa ancestors, so we can do what we had also envisioning. I thank you once again. Over these 3 days, we have watched deans and educators debate curriculum with real rigor. We have heard the ministers and the policymakers speak candidly about the gaps in our systems. We have listened to the medical student and the young professional speak with the clarity and the urgency of that should humble those of us further along in our career, and have seen partners from the cross sectors and the border commit on openly in carrying this work. Together, that's exactly what the conference was meant to produce. We come into this week aware of the scale of the challenge before us, the shortage of the trained health workers, the uneven distribution across our region, the gap between what our curriculum teach and what our health systems actually demand. I do not believe 3 days close the gap, but I do believe this conference has done something equally important. It has sharpened our shared or understanding of the problem, and it has strengthened the partnership we will need to solve. So my ask as we leave this room is simple. Do not let the ideas raised here stay within these walls. Take them back to your institutions, your ministries, your associations, and your communities. Turn the commitments made this week into curriculum that are revised into the policies that are drafted into a partnership that are formalized. Let Addis Ababa remember not only a conversation but as a turning point. To our core hosts, COMSA and the University of the Global Health Equity, to every dean, ministers, health professional, and student leaders who gave their time and insight this week, and to the team who worked behind the scene to make this conference possible. I thank you once again. It's because of you that this gathering held here in Addis Ababa, the seats of the African Union carried to waited on behalf of the Federal Democratic Republic of Ethiopia and on behalf of the Federal Minister of Health of Ethiopia. Thank you for being and trusting us to host this event and for your candor and your commitment and safe travel to all of you returning home. I look forward to seeing you what we build together before we meet again. I once thank you again for trusting and to host this event. And I hope you will have also, you will enjoy, even in the afternoon, you will have some historical place like Adwa. And if you have a time, our ancestors, especially Ethiopia's previously was administered by the kingdom administration before we came to the bureaucratic. So I hope you will see what the government of Ethiopia, the historical, everybody listen about Ethiopia is the founder of the Coffee Arabica, the founder of Human Cradle, the founder of the African Union and all the UN organization, but you will see in practical terms, especially when you will visit those historical places and you will enjoy. I wish you all the best during your stay. For those who's traveling from here to the abroad, safe travel, bon voyage, merci beaucoup, asante sana, karibu, thank you. Amasaganali.
Thank you very much, Your Excellency Saharallah Abdullahi, State Minister of Health, for that gracious opening. Indeed, ladies and gentlemen, Ethiopia is a country with over 3,000 years of history, but Ethiopia is also a country of the future. Thank you, Your Excellency, for reminding us of Ethiopia's historical legacy and the rich future that awaits our country. Now, Excellencies, a conference of this magnitude, bringing nations and nationalities across Africa and beyond, would simply be impossible without the relentless, behind the scenes dedication of our committees. We now move into a special segment where we express our gratitude to these committees for their monumental efforts. To present the recognition to the committees, I would like to invite a man who has been called extraordinary by his colleagues. Ladies and gentlemen, please welcome Professor Abebe Bakala, the Secretary General of COMSA, the extraordinary, as they call him.
Good afternoon, ladies and gentlemen. I was scolded by my wife earlier. I think I shouted on you on Monday. I was very close to the mic. The very first advice she gave me was stay away from the mic. I'll try to do that now. As the MC said, such a beautiful gathering of 3 days. It didn't just happen. The very first meeting we had was last October. This is a result of 8 continuous months of preparation. And I think you all agree with me that it's right to acknowledge the people who were behind this. I'll be standing here for about 5 minutes to acknowledge those men and women who helped make this. I'll probably come back again to acknowledge the institutions that were. Please allow me to present the members of the International Steering Committee so that they can come to the front and be recognized by the President and the Vice President. I'm going to call them as a group. If the group could come together, receive your certificates, and take a group picture, you can do that. So the chair of the scientific committee is Her Excellency Ms. Sarala Abdullahi. Dr. Elsie Kuguli Malwadi, Mr. Aseged Samuel, Dr. Zori Talib, Professor Simon Pierre Chukam, Dr. Amal Saleh, Dr. Solomon Wergu, Dr. Aschalo Wergu, Dr. Henok Tadele, Dr. Mulukan Tesfaye, Dr. Merertu Temesgen, Dr. Rihana Nursema, and Mohammed Teni. Ladies and gentlemen, the International Steering Committee. Please allow me to now present the COMSA/UGHE Secretariat who traveled from Rwanda, I think a week ago, to make this thing happen. Again, I'm going to call the members. Dr. Kara Louise Neal, Mimi Sugira, Rahel Murakatete, Rashida Dambizira, Rosaline Benengina, Mr. Rayond, Lisa Berwa, Melissa Ichiza, and Rosine Musafiri. Oh, Victor. My sincere apologies. Dr. Victor. I expect another scolding later. Fantastic. Thank you very much, friends. As you can see, a beautifully arranged conference venue, well decorated, logistics beautifully carried out. This was done by the local team based in Italy, under the leadership of Her Excellency, Minister, and Mr. Assegid. These are the following: Dr. Birara, Dr. Betel Amanuel, Dr. Muse Vittorio, Fikr Belleta, Kubra Gobeze, Dr. Abdul Salam Khalil, Tashome Fakadu, Leta Tagesu, Biniam Altamo, Bethlehem Adana, Tolera Garamo, and Getacho Molla. If you are in this room, please step forward. If you are not, please accept our sincere words of appreciation. The last group is an independent committee. This independent committee is chaired by Dr. Amal Saleh, who will come after me, present what they have done. But I want to call them to the podium to be recognized by the President and the Vice President. These are Dr. Amal Saleh, Dr. Barnabas Alayande, Dr. Merertu Tamesgen, Professor Adeola Faotade, Dr. David Mulenga, Dr. Didier Kamatari, Dr. Dorothy Kamya, Dr. Yusuf Ahmed Ali, Dr. Bamba Gaye, Professor Simon Titus, Dr. Victor Miti, and Dr. Cara Louise Neal. I'm informed Dr. Chivagon Gordon is not with us today. Thank you very much, ladies and gentlemen.
Thank you very much to Professor Abebe Bekele, and also congratulations to all those who received the recognition. Thank you so much as well, Professor Lionel Green Thompson and Yvonne. Ladies and gentlemen, we now go to the next awards and recognition segment, awarding the best papers and also poster presentations to provide a reflective summary of the profound scientific achievements and the research trends that emerged over these 3 days. Please give a warm welcome to Dr. Amal Saleh. Just to briefly introduce Dr. Amal, Dr. Amal is a very accomplished neuroradiologist and associate professor of radiology at the Addis Ababa University College of Health Sciences. Please give a warm welcome to Dr. Amal Saleh, one of the very accomplished female scholars in MedEdAfrica 2026. Welcome.
Your Excellency, Zahrallah, President Lionel, ladies and gentlemen. So I'm going to briefly walk you through what we did as a scientific committee. These are the members. You've already seen who they are. I just want to show the distribution across Africa, representing the majority of the different regions of Africa. So these are the members of the committees. I'm going to walk you through the process of how we did the abstract, the call for abstract, and how we went about picking the final winner. So the call for abstract went out earlier this year. The deadline was April 30th. And for the first time, the abstract call was also made in French so that we could be more inclusive of our Francophone brothers and sisters. This was the portal that we used for people to submit their abstract. We were pleasantly surprised that we had a total of 551 submissions for this call for abstract. And this is the distribution of the presentation. So we had them into 4 different themes, and this is how we allocated it. To show you the geographic distribution, again, you can see the majority of the submissions were from East Africa, followed by West Africa. And we did have submissions from some parts of Western and Central Africa, but not as much as we expected in North Africa. The professional distribution was almost split down the middle, so faculty and students were fairly well represented. We're still trying to figure out the 15% that we couldn't place in both. But this was, we were pleasantly surprised and very happy to see that students were involved and really confident in doing the work. The flow, so as Prof. Ababa has mentioned, it was independently done. We had a double-blinded method of assessing the abstracts, so we did not know who they were in the first phase. So 2 people were able to review the abstracts first, and then based on that, we went into the second round of reviews. And finally, we did put in equity points for geographic distribution, gender balance, and institutional diversity were some points that we added at the end following the scientific merits assessment. So as I mentioned, we had 551. You can see that the majority was in gender and health system strengthening. And then having done the first round of survey and scoring and going through the second round, we finally had 167 really excellent abstracts that were submitted. This also included the workshops that we also assessed. So finally, we were able to pick the best 40 poster presentations and 42 oral. So these were the scheduled ones. However, those who showed up for the presentations were 39 oral presentations and posters were 21. So I just want to pose here that we really had an excellent group of submissions, but the majority were not able to join for financial constraints. And I would really like to press upon different deans and policymakers to allocate some funds to these individuals who are doing really great, but were not able to be here and participate in person. So that was one point I want. At this juncture, I would like to call my co-chair, Dr. Barnabas, to help me announce the winners for these abstract questions. And I would also like to call upon President Professor Lionel to help us with giving these awards. So we had 4 awardees, which are allocated, but we were only able to give 3 awards. So we had a distribution of students and faculty, so we judged them separately as well because we thought, we needed to encourage the students as well. So for the oral presentations, we have 1 faculty and 1 student that was awarded, but for the poster, we only had 1 faculty who managed to win the award. Unfortunately, we couldn't score the student high enough to give them the award, so perhaps this is an opportunity for our deans and faculty to coach our students because they really did write a very good abstract, but the presentation was a little bit behind, and we would love to have you support them in the future. So the awardees are for the faculty oral presentation. It's Ibrahim Abu Sufyan from Al-Zahri University, Sudan.
And the award actually comes with a $500 prize. And so, congratulations.
So the student awardee is Tawango Chisenga from Kumuzu University of Health Sciences in Malawi. Tawango? And for the poster presentation from faculty, we have a winner, Emmanuel Adana Bito from the University of Global Health Equity, Rwanda. Dr. Emmanuel? So these are the awardees, and thank you very much to all committee members for the excellent job that they did and the dedication, and of course, Komsa and everybody who is helping us. And I want to give a special thank you to Victor and Kara. We couldn't have done it without them, so thank you very much.
And thank you to you as well, Dr. Amal Saleh, for leading that recognition ceremony, and congratulations as well to those young faces we saw with a bright future ahead of them. Your Excellencies, distinguished guests, we conclude this award segment with a prestigious Lifetime Achievement Awards in medical education. This is an honor that recognizes an entire lifetime of dedication to transforming healthcare and education in Africa. This ceremony will give tribute to an entire life well lived, an entire life dedicated to the voiceless and the defenseless. To lead this prestigious ceremony and to announce the criteria, it is an honor to welcome the Awards Committee Chair and Vice President of COMSA, Professor Yvonne Day Adomako. Please give a warm welcome to Professor Yvonne.
Here are instituted awards. Recognize excellence at the Women in Leadership Award and Lifetime Honor. We had a member committee set up, board from the, and it had, we went through a very rigorous selection process. We asked a lot of questions. We wanted to know who has given a lifetime of, who has achieved greatly and lifted others as they climbed, who has left our institution, our profession, and our community better than they found it. So after a very rigorous selection process, he was unanimous. This afternoon, we honor a woman, character, impact. Her work speaks for itself. The legacy speaks for those who come here. I'd like to read short. So, ladies and gentlemen, it is a great privilege to present a citation for the Consortium of Medical Schools of Africa inaugural Lifetime Achievement Award, Medical Education. Professor Ziniyat Fisher is an He is an internationally renowned physician, educator, a lawyer, a public health leader, and one of Africa's most influential champions for health equity, women's health, and the transformation of medical education. Currently serving as Vice President of Global Programs at the Thompson Buffet Foundation, leads one of the world's largest global health portfolios, supporting efforts to strengthen health systems, primary health care, and the health and well-being of women and girls across low and middle-income countries. Born in Ethiopia, Professor Fisher pursued her medical and legal education in the United States. After more than 3 decades of distinguished academic and clinical leadership, she made the remarkable decision to return to Africa. Driven by a conviction that lasting change is achieved by building strong African institutions and empowering Africa. Her influence extends well beyond any single institution. Since 2017, she has served as a chief advisor, the Director General of the World Health Organization. She has also served on numerous influential international bodies, including the WHO Council on the Economics of Health for All, the WHO Director General's Expert Group, Cervical Cancer Elimination, the African Union COVID-19 Commission, Chatham House Commission for Universal Health, the Lancet Commission on 21st Century Global Threats, and as co-chair of the Conference of the Public Health Africa. Her leadership in digital innovation is equally remarkable, serving on the steering committee of the Partnership for Digital Access in Africa and co-chairing the Global AI Summit in Africa. An accomplished obstetrician and gynecologist, Professor Fisher served as chief of the Division of Reproductive Endocrinology and Infertility at the University of Michigan as the founding executive director of the Center for International Reproductive Health, pioneered a transformative model for strengthening health professions education across Ethiopia and sub-Saharan Africa. Faculty development, educational innovation, research, institutional capacity. Yet it is her contribution to medical education in Africa that makes her truly. Professor Fisher played a pivotal role in establishing St. Paul Hospital Millennium Medical College, helping create one of Ethiopia's leading medical schools, significantly expanding specialty and specialty. Through this work, he helped educate a new generation of African and specialists. Her leadership has extended across the country through partnership with the University of Rwanda, Faisal Teaching Ministry of Health of strengthened postgraduate postgraduate medical education, faculty development, national capacity, always emphasizing African ownership, long-term sustainability. Driven by her unwavering belief that Africa must educate, retain, and lead its own health workforce, conceived and spearheaded the establishment of the African Health Sciences University in Rwanda. Today, the university trains specialist physicians from Rwanda and across Africa in multiple residency programs, helping address one of the continent's great. He has also been instrumental in establishing, strengthening residency and fellowship training programs across several African countries, enabling African institutions to train highly skilled specialists at home rather than relying on training abroad. Equally important, has forged enduring partnerships between African universities and international institutions, grounded in mutual respect, shared learning, and strengthening. These collaborations have transformed medical education while delivering tangible improvements in patient care, including the establishment of sustainable kidney transplant in Ethiopia and Rwanda. Her contributions to the establishment and development of the WHO Academy is also very significant. Professor Fisher's remarkable contributions have earned her numerous international, including recognition in New African Magazine's 100 most influential Africa, the 100 most influential people in gender policy, Athens 40's top 40 most forward-thinking women, and most recently, doctorate in international health from Southern Illinois University. Yet perhaps a great what she had the lives, educators that she had formed. Professor Senat Fisher embodies the very ideals upon founded. That is excellence, equity, ability, and an unwavering belief that Africa depends on educating its own workforce. It is therefore my great honor, on behalf of the consortium, to announce Professor Senat Fisher as recipient of COMSA Lifetime Achievement Award in Medical Education and in Africa. Professor Fisher, through your visionary leadership, unwavering commitment, and extraordinary lifetime of service,
a standing ovation to Professor Sanait Fasaha, recipient of the Lifetime Achievement Award. A life that has created impact, a life that has changed the lives of many others. Ladies and gentlemen, the Lifetime Achievement Award to Professor Sanait Congratulations to Professor Sanait Fisaha, the recipient of the Lifetime Achievement Award. Congratulations, congratulations, congratulations to Professor Sanait Fisaha.
It is a great day indeed. Unfortunately, the recipient of that award Fisher has
this is really extraordinary. Thank you very much. I do accept this Lifetime Award with deep humility, but not as a celebration of one's career. I really accept it as a tribute to a shared struggle and a shared responsibility. So yeah, this really truly means the world. I can't help acknowledge there's so many people. I look back and I can't believe it's almost been 3 decades since I started my work here. And had it not been for partners like Dr. Tedros, the now WHO Director General, who was the health minister at that time, who had the vision to radically change medical education in Ethiopia. At that time, we had 3 medical schools, 2 or 3, not 3, Jimma, Gondar, and Addis Ababa University. And we knew as the population was growing, we weren't going to make a difference training 100, 150 doctors a year, which half of them would leave the country. So he came up with strategy to scale up training, and I was given the immense privilege of supporting St. Paul, which was a fledgling regional community hospital that was used as an attachment site for students from Black Lion. So fast forward 30 years later, we not only established extraordinary medical school that has a very unique curriculum, but also have expansive residency and fellowship programs in some of the specialty centers in the country. So when I look around the room, I see colleagues who've been along with the journey, the establishment of CERT, St. Paul, and so many other institutions throughout Ethiopia and Africa. I don't think I would have been able to do this job had it not been for my husband, Dr. Tedros Fisaha, who unfortunately always ends up playing the role in the back. He's a robotic urologic surgeon, so when I was poking fun yesterday with the specialists, I have one at home. But he has made it possible for me to combine a career in global health and raising 4 extraordinary children, maintaining work-life balance. Working in medicine, law, global health, and policy, I have developed few deep convictions I want to leave you with. First, medical education and broadly health workforce development is truly nation building. Every health worker we train is a life saved, a family protected, a system strengthened, and a country made more resilient. So it should not just be looked at one other investment. This is truly part of nation building in my eyes. Second, Africa does not lack excellence. Africa lacks the scale of investment that excellence deserves. So our task is not to import greatness, but really to trust it, to train it, to resource it, and let it lead. And lastly, there can be no health justice without women and girls at the center. Women's health must not be marginalized. It cannot be left at the side. I will plead with the academic deans of the 190 medical school present, virtually participating to the government partners, that we cannot part and parcel some of the health priorities and leave them on the side. So for me, when women lead, communities lead. When women succeed, communities succeed. So I really, truly dedicate this special award to the frontline health workers who serve every day where courage is required. We've seen them in COVID wards, in Ebola units, in disaster and war and conflict, as well as taking care of the everyday mundane, from a headache to diarrhea. You always rely from your nurse to your midwife to your doctor. So this goes to you for the work you do every day. You are the ones who put your lives at risk so that others live. So this award really, truly belongs to you. So may we leave this gathering today with one commitment: to really build Africa where excellence is not the exception, equity is not an aspiration, and every healthcare provider is really treated as a national resource. Thank you very much.
Thank you very much to Professor Sanait Fasaha, the Medical Education Laureate. Ladies and gentlemen, we cannot have enough warm rounds of applause to Professor Sanait for all the impact that she has made. And on a personal level, thank you to Professor Sanait Fasaha for inspiring women and girls like myself to believe that if we put our minds to it, only the sky is the limit. Women in the room, are you here? Ladies and gentlemen, we believe that Addis Ababa with the MedEdAfrica 2026 has set the bar higher, but a baton needs to be passed on to the next host. So now we're going to have the very exciting announcement of the host of MedEdAfrica 2027. Please welcome back to the stage Professor Lionel Green Thompson, President of COMSA, for this exciting announcement. Prof, we cannot have enough of you today. Welcome back again.
Let me invite the Dean Jane Misihai Rabgui to join me. So for the first time, we've had a second conference for the first time, I suppose that's also a first. But for the first time, we had a competitive process asking the universities to apply to host. And we asked a couple of things of them. One was just the physical capacity. As you've seen here, it's a significant physical resource, but also a connection and a set of relationships within the country to assist us in hosting a conference. And so I'm very pleased to announce that the MedEd 2027 will be hosted by the University of Namibia in Windhoek next year. And Professor Jane is the dean of that. You want to say something?
Thank you so much. On behalf of the University of Namibia and our key stakeholders, I would like to just take this opportunity to accept the selection. It's an absolute honor for us. I will not say much here in Ethiopia, but I may say much in Namibia. But what I will only say is that we may not be the best producers of coffee or jollof rice, but you need to come over to see what we are best at. Thank you.
And now we'll watch a promotional video for Namibia.
Ladies and gentlemen, the beautiful Namibia, host of MedEdAfrica 2027. And now for the vote of thanks, we welcome back to the stage Professor Ababa Bakala to acknowledge and to thank all of our partners. Please welcome the professor.
Thank you. Thank you very much. Beyond individuals, there are institutions that made this beautiful event happen. On the behalf of the leadership of the Consortium of Medical Schools in Africa, I would like to first start by acknowledging the Ministry of Health, Ethiopia, for hosting this event. And I will read the list of institutions that helped make this come true. The University of Global Health Equity, UGHE, Addis Ababa University, St. Paul Millennium Medical College, Yekati 12 Hospital Medical College, the Gates Foundation, the Carnegie Foundation, Novartis, Arupe Global Scholars and Partnerships of the Creighton University, Smile Train, Ethiopian Airlines, the official carrier of the conference, the Ministry of Foreign Affairs, International Organization Affairs Directorate, the Ministry of Tourism, and Ethiopian Telecom. The Center for International Reproductive Health Training, CERT, Ministry of Health Ethiopia, JPIGO, Ethiopian Airlines, the American International Health Alliance, the St. Paul's Hospital Millennium Medical College, ABH Partners, Addis Ababa University, Jimma University, Ethiopian Medical Students Association, the Myung Sung Medical College, Lake Churio, Sante Medical College, and African CDC, Center for Disease Control and Prevention, were instrumental in the exhibition. We'd also like to acknowledge Flawless Events for this beautiful organization, our media partners, and the Skylight Hotel for hospitality and their support throughout the conference. Thank you very much.
Thank you very much, Professor Abebe, for presenting the official gratitude to our sponsors. Now, ladies and gentlemen, with that, we conclude MedEdAfrica 2026. Can we give a warm round of applause and officially close it together? It was teamwork, ladies and gentlemen, and we're closing it together. Now, as we conclude, there are going to be buses for the Addis Ababa city tour, and the buses will depart right away as we leave here. And please note that there's also going to be another conference called East Africa Healthcare Federation Conference and Exhibition. For those who would like to register and participate, it's going to take place on August 21 to 23. We'll put the QR code on the screen. In addition to that, we still have 4 headsets missing. So if one slid into your bag by mistake, please leave it here. Once again, thank you all so much. Safe travels back home. We'll give priority to our guests of honor as they take their leave. The rest of us will also follow. May God bless Africa and her people. Thank you, ladies and gentlemen. This is the QR code for East African Healthcare Federation Conference and Exhibition. If you'd like to participate, it's on August 21 to 23. You can scan the QR code.
requires next-generation scientists. In partnership with the University of Basel, we invite talented young scientists and clinicians from developing countries across Africa, Asia, and Latin America to our Basel. And knowledge in partnership with Novartis scientist mentors and each other. Interns work on